Good evening. Today is Wednesday, April 1st, 2020. Welcome to the weekly live Facebook question and answer forum hosted Wednesday nights by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Public Information Officer with Stanislaus County. We will be moderating tonight's Facebook Live event, which will be recorded and posted later to the Stan Emergency Facebook page.
We will not be appearing on camera tonight, but you will hear our voices as we help to navigate the screen and also to direct your questions to our panelists regarding COVID-19 in our county.
Joining us tonight is Dr. Julie Vaishampayan, who we will refer to as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Stanislaus County Superintendent of Schools Scott Kuykendall, who is taking the place of Ruben Imperial, our Behavioral Health and Recovery Services Director. Ruben is not feeling well tonight and is following the CDC guidelines to stay home.
Let's begin tonight with Dr. V for an update on the latest number of cases in our county. Dr. V?
Sure. So today we reported 44 people who have tested positive for this new coronavirus in our county. We have almost 1,200 people who have tested negative, and we still have no deaths.
A lot of questions surrounding a potential surge. What work right now is being done to prepare for a potential surge in Stanislaus County?
Yeah, we have a team working on this, working with our hospitals, trying to get all our surge plans together. And this is really important work, and we're getting it close to being ready to communicate to the community. So we want to be really transparent and do that very soon, but we're not quite ready yet. I do want to say that one of the biggest variables that's in our model that we can have an impact on is our social distancing. And we really need to be staying home, and a lot of our model depends on us really being very careful to only go out for essential services.
Thank you, Dr. V. It's important for all of us to remember that. Sheriff, where are we with enforcement, and what are we planning to do?
Yeah, so we have started the enforcement protocols really over a week ago, specifically focusing on education. This week on Monday, we transitioned into more of a direct contact. As you know, we had developed a letter, a cease and desist letter, that was agreed upon both at the county and across all 9 of our cities. And beginning on Monday, any of the businesses that were specifically on the prohibited list, and I'll come back to that in a minute, we started making direct contact with any of those businesses that were still open, delivering that letter. And those 4 categories that we focused on initially are bars, gyms or fitness centers, restaurants that were still doing dine-in, and then hair and nail salons. There's a lot of ambiguity around the essential businesses, but there was none specifically with those. They are called out at the state level what they must close. And so thankfully, virtually everyone that we have contacted has immediately complied, and they have closed. And so we really appreciate that. So as far as where we're going, last night Dr. V issued a new public health order specific for Stanislaus County, and that it is online, you can review it, and that order will go into effect at 5 o'clock tomorrow morning. And while that order is somewhat more restrictive, it adds a lot of specificity to it. So in addition to those 4 categories that I mentioned, it has modified restaurants specifically. While you can still go to a restaurant and pick up food, you're not allowed to go into the restaurant. It has to be curbside pickup only. The other categories that are in there are dog groomers. We had a lot of complaints about dog grooming businesses that were still open, and so they are specifically named as being closed. Golf courses are in this order, along with any kind of bingo hall, card room, anything like that. And the order is up for everyone to review. And again, if you see a business like that is open, we're going to provide you with the email. Please email that business name directly to us, and we will make contact with those businesses and ask them to close. And again, thankfully, everyone is doing their part. They are closing, and we certainly appreciate that.
You know, since we're on the topic of essential and non-essential businesses, many essential employers were hearing on our Facebook live feed, feed over the last couple of days. Many essential employers have issued letters for their employees in case that they're stopped. Are you actively stopping people out on the roads?
No, we are not. And with that, employers don't need to issue that letter. I've had personal conversations with many of them. It's not going to hurt if they do, but no, we are not stopping people that are on the roadway. Let's remember, the order does not prevent you from going out for essential services. So people can be out. They can be going to the store if they need supplies. They can be exercising, they can be running, walking their dog, whatever the case may be. So, there's some confusion that people think that they're locked down. That's not really an accurate statement. This is a stay-at-home order, except for essential services and essential businesses. What I would encourage everyone to do is look at the state's website, the COVID-19 website, and it has all the specifics on there. There is great ambiguity over what's essential and what is not. And I'm just going to be upfront on that. Today I had an email from a lady referencing a fabric store that was open, and she felt that was not essential. What I would tell you is that right now, with many people making fabric face masks to prevent the spread of the virus, that is definitely an essential business in our current climate. So please familiarize yourself with what is defined as essential and what is not.
Thank you, Sheriff Dirksey. Along those lines, I'm going to go back to Dr. V for a second. Can you tell us a little bit more about the executive order that just went into effect or will go into effect tomorrow morning, why we felt the need to implement that order, and really what has changed since a week ago or since early this week?
Yeah, so the order by the governor referred to a list of essential services that's posted on the state website. So anyone can go look at those essential services. But it's broad, and many businesses weren't quite sure if they were deemed essential and supposed to stay open, or they needed to close. And so this order was an attempt to define and help people understand what is considered essential in this county and what is not.
Thank you very much, Dr. V. This next question is going to be for the superintendent. Today, we heard a big announcement from the State Superintendent of Public Schools, as well as the governor. Can you talk a little bit about what this big announcement is?
Yeah, so some disappointing news actually from the state level, from the governor's office. The 25 school districts here in Stanislaus County have really been wanting to have our students come back to school this year. And what's been made very clear, especially today, is that that is not going to happen. So the governor went on live during a press conference and made it very clear that schools shouldn't open prior to the end of the year. So we're in the process right now of communicating out with our districts, with our communities, with our families, and letting them know of this news. And now our districts are working with their staffs to prepare for the next several weeks as we implement more of our distance learning opportunities for students. So it's going to look different. Again, it was really our hope as a father of 3 sons who are currently attending public schools here in Stanislaus County. The hope was that students could return, but we're at a point now that that is not going to happen, and now we're going to do everything that we can on our end to prepare for the remainder of the year.
Thank you, Scott. So obviously a lot of parents are reeling, students are reeling, teachers. What are the priority issues and discussion topics right now?
Right.
At the district level.
So I think it's really important, first and foremost, that we all recognize that we're in the middle of a health crisis. So first and foremost, it's our priority that our students are safe, that our staff is safe, and then we move on to our nutritional services, our students receiving meals, our people being notified of where they can pick meals up. Now, it's extremely important that our schools are beginning to work with teachers and begin talking about what this new curriculum delivery looks like, be it distance learning, be it educational packets, whatever the case may be, because while it's true that the physical school is going to remain closed, I want to make it very clear that education is still going to continue. And that's a very important message, and I want to make sure that everybody understands that. Education will continue even though our schools are closed. Another priority that we're really wanting to stress is making sure that our teachers and our students have the ability to connect, and even our students have the ability to connect with their peers. The social emotional piece is really important right now, because we are staying at home as much as we can. There are issues of isolation, anxiety, depression, and we really want to make sure that we're doing all that we can to alleviate any of those anxieties moving forward.
Thank you very much for that, and we're probably going to get quite a few questions about your new announcement today. I want to get back to Dr. V, though. Over the last couple of days, we've been sharing a lot of new data. Can you break down some of these numbers a little bit? Cases in each location, the gender, what towns are in the county, and what all of this means?
We posted the data starting yesterday. We wanted to wait until we had a certain number of cases. We picked 35 as the number of cases where we would start breaking it down into smaller groups. When you have less cases than that, it's really hard to break down and have it mean much. So you can go to the website and see our case data, but there's a couple points about here. Some of the questions I've seen are about the age groups and why younger people seem to have a lot of age. So first of all, we broke it down by the same age groups as the state of California. So you'll be able to compare our numbers in this county to what it looks like statewide. And second of all, the age group for first of all, let me go back a bit. Everybody's susceptible to this disease, right? So it's not surprising that we're seeing infections in all age groups. So it's not that this disease, this coronavirus, infects older people more. It's just that they are at risk to have more severe disease and become hospitalized. So as you look at the numbers that we have posted, what you'll see is that first age group, which I think is like 18 to 50 or 49 or something like that. It's about 30 years of age, right? 31, 32. And so it's a lot of people in that age group, so you're going to see many cases there. The next age group is 15 years of age group, so you would expect to see half as many cases in that age group at the most. So you really have to look at how many people are in those age groups. It's not that younger people have more infections being diagnosed, it's just that they're split into a larger age group. And then a word on the cities. So these really are following a population distribution, right? So coronavirus is a respiratory disease, and respiratory diseases don't recognize city limits. And so, it's not surprising that these are distributed throughout the county. We believe that there is coronavirus disease happening in every single city in our county. It is being spread, and just because someone hasn't been diagnosed in a city does not mean it's not there. And then when you look at the numbers, because Modesto has the largest population, they're statistically going to have the most cases, and that is what we see.
Thank you, Dr. V. So there's a Facebook question that came in that I think it would be appropriate to address right now. Nanette wants to know how many of the individuals who are confirmed as having been infected are in the hospital in an ICU?
That's a difficult question to answer, actually. So of our 44 cases, 22 were hospitalized at the time of diagnosis. And we know our testing is more complete in hospital than it is outside the hospital. So the 22 have ever been hospitalized so far with this infection. The question for our county, how many are in the ICU? Well, not every person in an ICU in our county is a Stanislaus County resident. We do get people in our hospitals from Merced. We get people from San Joaquin. So our adjoining counties do have people that come to our hospitals, and so they may be in our ICUs currently. I wouldn't know those data, but for our people, 22 so far have been hospitalized.
Thank you very much for that answer. This next question is for Sheriff Dirkse. This came in from Jackie Eakins on our Facebook Live feed. And Jackie is asking, is a small hardware store considered an essential critical business? And where can she read more about the copy of that order?
So first, the order will be posted both at the Stand Emergency, and we can repost it on Facebook as well. So with that, and I'm going to talk generally about stores. So most things like a hardware store, yes, they are going to fall into that essential category because they provide things for home maintenance and repairs and so on. The challenge is that a lot of folks are going to hardware stores for things that are not essential. They have time on their hands and they're electing to make use of that time. And while there is nothing that we can do to prohibit that specifically, I would just ask everyone to reevaluate why they're going out and why they're exposing both themselves and the community to potential spread of the coronavirus, and ask yourself, is this necessary or not? And that same thing kind of holds true for many, many different business categories across our county. And I will also say what you think is non-essential may also be essential to someone else. I can give you many examples. I brought up the fabric store earlier. That would have been something I probably would have thought of as non-essential. However, again, many people are making fabric masks right now to prevent the spread of the coronavirus. So clearly that would fall into the essential category. The same could be said for a number of other businesses. So again, review that list. And I'm just going to be very clear. It's very ambiguous. And that is one of the things that we, both in Stanislaus County and really across the state, are looking at, is the ambiguity of what is essential and what is not essential. That list, these 16 essential functions, was actually drawn from a federal list for wartime. It did not take into account something like a virus, a pandemic, an epidemic, anything like that. It was more for a traditional war. And so it doesn't have direct application, but that is what we are all operating off of right now.
We're all stick with you for just a minute because this pertains along the same topic. There's a lot of confusion on what dine out and curbside is. And so right now, Monica Partita asked, for small businesses, we can't have any to-go orders even if we follow the social distance guidelines?
So you can pick up an order from a restaurant. What we are trying to prevent is this. What we've seen at a lot of the restaurants that are also doing takeout is people are going inside, they are congregating in the lobby, the foyer, the entry area, waiting for their takeout order. And they're violating the social distancing rules because they're within 6 feet, and there are simply too many people in there. So restaurants can still do takeout. All that we are mandating is that it's a curbside pickup, not someone entering the restaurant to pick the food up.
Got it. Thank you, Sheriff, for clarifying that question. The next question is for Superintendent Scott Kuykendall. How will schools make sure that our students are getting the education they need through distance learning so that they are prepared for next year? A lot of parents are concerned about that.
No, absolutely, and it's a great question. And what I want to just be very upfront about is that there is not going to be a substitute for your child meeting every day with their teacher in a classroom setting. Now, that being said, I know that our teachers are working really hard and being trained as we speak this week and going into next week to develop those skills that they need to deliver content in a meaningful and purposeful way online. But what we do need to realize as well is we really flipped the switch literally overnight by saying that we are going from a classroom environment to a distance learning model. And that's going to look different depending on which district you're currently attending. Now, some of our bigger districts here, located in the valley along the 99 corridor, have great access. They've got great broadband. But we need to remember, too, that Stanislaus County has smaller districts like Knights Ferry and Roberts Ferry that don't have that type of access. So while it's easy to say that if we just deploy devices and give our teachers a way to connect with students via the internet, that doesn't necessarily answer all of our questions. So it's a complicated answer, and what I want families to do is to be patient with our school districts as they're working through this. They are all committed to making this happen, but again, it's going to look different depending on your particular school district. And really the best resource for parents right now is your local school district. And I know that they are communicating with you on a regular basis, and right now they are creating that curriculum and they're training teachers to be able to effectively instruct your student actively and currently right now. I think that I also want to say that it might be healthy for us to look at this as an opportunity, almost a dress rehearsal, if you will. We really want to take this time for our teachers to get good at what they do and for us to become comfortable with this distance learning model, because what we haven't broached yet, and I think it's important, is that with this virus, this may very well be the first phase of this virus. It is likely that this virus may return next fall or next winter, and it really is an opportunity for us now to prepare and to hone in these skills so that in the unfortunate event that we do have to close schools again in the fall or next winter, we already have these systems in place. So I just want to reassure parents out there and students, we know that this is a big change for what you're typically, what you're used to and what our expectations are. We don't want you to stress about it. We don't want you to worry about it. We're going to make this happen and we're going to make this right. But in the meantime, we do need a little time on our end to do what is needed as far as teacher training and implementation.
Thank you so much. Speaking of fear and worry, there's a question that came in from Facebook. Joey Gordon wants to know if students will be repeating the same grade next year.
So the quick answer is no. The quick answer is no. I think it's important for parents and students to understand students will not be penalized in any way, shape, or form for the school closures. So that means that you're not going to be penalized with grades. If you are on track to go to the next grade, if you're on track for graduation, all of those things are going to happen. So you don't need to worry about that. So that even extends to what colleges and universities are now doing. Our California State University systems and our University of California systems are being very flexible with admissions for next year. They've even waived the SAT and the ACT tests that students normally would have taken this spring for admittance. They waived those for next year. They're accepting pass-fail grades if necessary. So I want students, again, to be reassured there is not going to be any penalty for the fact that schools have had to close because of this pandemic.
Thank you. I want to get back to Dr. V because this also addresses along the same lines. And this question came in from Natasha Marie on our Facebook feed. How long do you expect, the waves were just mentioned by Scott, potential waves mentioned by Scott. How long do you expect the stay-at-home order to last?
Everybody's asking really hard questions tonight. So that is another very difficult question. And I think it's going to absolutely depend on how well everybody stays home and doesn't go out except for their essential services. We are going to have to watch how this virus goes. We're going to have to watch how our hospitals and ICUs and ventilators that you hear so much about, their capacity and what's going on, and it's all going to depend on that. So I honestly can't answer that question right now. It's going to be going on for a while, and it really, really depends on all of us doing our part.
Thank you, Dr. V. Do you have any idea, now that we're watching the numbers increase every day, how high the numbers will actually go?
Well, this is, everybody knows this is a new virus. I think this is very hard to predict. There is no reason for us not to expect that this will continue to be with us and become one of our regular respiratory viruses that circulate each year like influenza. So that means that eventually we will start we'll stop counting these numbers because it will be a regular recurring virus. So there is I'm no limit to how high they can go. I think it just depends on when we decide it's here to stay and we really stop counting.
Thank you, Dr. V. Our next question is for Sheriff Dirksey. This also came in from our Facebook Live feed from Janelle. She wants to know, when we see groups of teens gathering for basketball games or congregating at parks, or parents taking their kids to closed park playgrounds, what should we do?
Well, the best thing to do would be to talk to the parents and tell them not to do it. I will be very upfront. Law enforcement, we are not arresting people over this. And that is agreed upon really across the county. And that is very much in keeping with the governor's intent as well. That being said, parents need to keep their kids out of the parks. Right? There is no ambiguity about that. Kids that are going for a run, walking the dog, anything like that is great. Playing a 4-on-4 basketball game is absolutely not in keeping with the intention of the order or with this idea of just getting exercise. Basketball is great exercise, don't get me wrong, but that is not something that we need to be doing. So the single biggest thing is, parents, deal with your kids on this issue. That is where this needs to start. This doesn't need to be a law enforcement issue.
This question sounds like it is a law enforcement type question. This person wants to know, is there a curfew in place in the county?
No, there is not a curfew in place in the county. There is no intention of imposing a curfew. And also we get a lot of questions about, are we in lockdown? So I want to talk about that for a minute too. We are not in lockdown. Lockdown is not really a defined term. So I know that it has been in the media, but I would encourage everyone to stop using that term. We are under a stay-at-home order, other than the essential services. So that's why we are telling everyone, stay at home. We're not under a quarantine. We're not under an isolation. Those are defined terms that have a very specific meaning. So again, we're at a stay-at-home order. So do the right thing and stay at home.
Thank you, Sheriff. So the next question is for Superintendent Kuykendall from Gary Roop. Do you need any retired teachers to help with homeschooling or video teaching?
Okay, that's a fantastic question, and that is all about, are there volunteer opportunities for retired teachers? And the answer is yes. One of the silver linings, I suppose, of this current situation is that people have become very innovative, and I've been able to see kind of the outpouring of goodness and kindness in this community. One of the things that is currently being worked on is a partnership with Love Our Cities, and we are actually working with them and putting together a Love Our Schools webpage. So I'm not sure how far along we are yet, but just check that periodically, loveourschools.org, I believe. And on it, what we want to do is be able to match retired teachers, student teachers, perhaps even college students, anybody who's willing to volunteer to tutor or help out students and families, to have them go there and sign up, and then the outreach would then be for families who are looking for a tutor to go and seek that assistance out. So that is currently in the works. So the short answer is yes. The longer answer is stay tuned, but Stanislaus County is a really fantastic place, and I'm really encouraged by the amount of folks coming out who want to volunteer and want to help and want to get involved.
Thank you so much. It's really, really encouraging to see, for sure. So another question from Facebook, Mallory Williard would like to know, obviously with online learning and distance learning, it's going to be difficult for families that don't have Wi-Fi. So what do you think about that, and what preparations are being made to help those people?
Okay, a couple of different things. So I know that districts right now are surveying their families and students as far as what connectivity they currently have in place. We've had some districts, Ceres Unified for instance, who rented I think, 700 MiFi hotspots, a portable hotspot, if you will, for internet service, and was giving those out to needy families. There are additional efforts like that happening throughout the county, depending on the district. In some instances, that may not be a workable solution. And in those instances, your schools, your teachers are going to work with you. And if it's a hard copy that you're going to need to make that happen, if it's a phone call instead of, and some type of, internet platform, a Zoom or a Google Hangout, if you will, then they'll make that happen as well. I know that our schools are committed to serving every single child in Stanislaus County. Again, though, you need to be patient with us as we're working through all of these different issues.
Thank you so much, Scott. This next question is for Dr. V. This came in from Raymond Boyle. And Raymond wants to know, when talking about the numbers of cases in our county, he wants to know, why is there no recovered data available?
Yeah, that's an interesting question. We're working to define that. Surprisingly, there isn't a standard definition for how we label recovered. And so I'm working with some of the other counties so we can come up with a consistent definition in California counties, and then we can put that up on the website. But we are waiting for a definition so that we're all calling recovered the same thing.
Thank you so much. That makes sense. So last week we talked a lot about testing and the lack of testing supplies being experienced across the world, really. Have testing supplies increased at all?
So no, we have not seen an increase in testing supplies here in Stanislaus County, or I think anywhere on the ground. You hear a lot about how they're expanding, how the FDA is approving many new tests, how there are more supplies coming in, but it takes time for them to get down to the local level and for us to use.
We've also heard, Dr. V, over the last couple of days, that there are newer, faster testing techniques coming out. What do we know about this?
So there's a whole bunch of new tests that the FDA has approved, some 20 minutes. I saw a 2-minute one today. So there's been at least 3 or 4 new quick tests that have been approved by the FDA, but it is my understanding, I'm not a laboratorian, but it's my understanding that it takes a while to have all these companies just really ramp up their production and get enough supply out into the community and into all our hospitals and areas where we can get this testing done and really increase the amount of tests we can do. So it's coming. It's going to take some time. I'm not quite sure how long it takes them to get the production going, but it is something they're working on, and we do have some hope for some increase in the future.
Thank you. That's encouraging to hear. So states and counties are handling this in different ways as information changes. And we did hear this week that the CDC announced that 25% of those who test positive can be totally asymptomatic. As a response, Riverside County has mandated that everyone wear a face covering when going out into public. They actually have a slogan, stay in your place, maintain your space, cover your face. So do you see that happening in Stanislaus County?
That's a really nice slogan. I wish we'd thought of it here. So yeah, the data are quite concerning about 25% asymptomatic, and many of the studies that have come out recently, it's almost more pre-symptomatic. So they've found that people can test positive like about 2 days before they start exhibiting symptoms. And so that's very concerning to us because previous coronaviruses really didn't spread before someone started feeling ill. So it's quite concerning that you can spread before becoming ill, and then there are some people who don't develop symptoms at all, and it is not yet clear from what I've read that they are transmitting it to other people and spreading disease. widely or at all. It might be a rare event, it might be a low event, but what we're really more worried about are those people who are spreading it before they become symptomatic. So one of the solutions that we're talking about, and Riverside has implemented, and we've been talking about all through California counties, the governor talked about it today on his press conference, is to have people start covering their face, their mouths, and their noses when they go out into public. And to be clear, there's two things. One is we don't want to call this masking, although I might slip up and say masking because that's, we're thinking about it as covering our face. But because it's, first of all, there aren't enough medical masks for our healthcare workers, so that's not the purpose of what we're talking about here. In this covering your mouth and nose are not to protect yourself from getting ill. It's, again, that source control that we've talked about. It's to protect you, those around you, from you spreading it before you become symptomatic. So we're hoping that everyone who doesn't feel well stays home. But if you don't know if you're not going to feel well tomorrow, and so you might be out going to the grocery store. So what we're looking at is those fabric masks that people are wearing. I know the sheriff just talked about that with Joann's Fabrics, and so you can make yourself a mask. You can wrap a scarf around your nose and mouth. It might help stop transmission. So two things about that. One is there's some instructions on the Vanderbilt site, and they will give you that link, and it tells you how to make a mask and gives you some patterns, and so that's very helpful, I think. Be sure and launder them frequently. But the other thing is just be sure that when you wear it, you remember that it is to protect others from you, and that's really what we're trying to get around. The more we can slow down transmission, if this helps us slow it down by 5%, by 10%, that's really going to help us with the disease spread. And anything we can do to help us and to move us through this more quickly and better is something that we really desire. One of the things we want to make sure people don't do is say, okay, I have a mask on, now I can go congregate places and I can go do non-essential travel and running around and congregating and doing all those things we're trying to get people to stop. This is not a substitute for that, and that's why in their slogan, they talk about stay at home, and they talk about maintaining your space, which means keep your 6-foot distance still. So hopefully this might help us. It might stop us from touching our nose and our mouth more frequently because now they're covered. Another concern is we don't want you touching your mask more and then contaminating yourself even more, so be sure and wash your hands after you take it off. But if it helps us, we're all for it.
Thank you, Dr. V. This next question came in originally for the sheriff, but you could probably answer this as well. I'll address it first to the sheriff, but if you have some thoughts that you'd like to add, I'd like to open it up to you. There have been a lot of news stories lately about first responders and law enforcement becoming infected. And so this question came in from our Facebook feed in the last couple of days. How are you protecting your team on the front lines?
Yeah, we've taken several steps across the department. We have enhanced screening for our staff, specifically in our custodial facilities, our jails. No one gets into those buildings without getting a screening, getting their temperature taken at the very least. That's for staff, that's for inmates. For our other staff, they've all been issued PPE that we wear when it's appropriate. We have an entire process set aside specifically for the testing if there's an on-duty exposure. That way we can evaluate them and get them either into the appropriate treatment or back on duty as fast as we possibly can. So with that too, I kind of want to talk a little bit about our custodial setting. With that, our concern is not only about our staff, it's also about the inmates that are in our custody. And I have stated very clearly that I have no intention of releasing criminals back onto the street. This is not a capacity issue, but we also take very seriously our responsibility to care for them. They are segregated in appropriate ways to minimize contact. We have restricted our outside visits, whether that's from family members or from the program providers, the folks that come in and provide various classes and so on for the inmates, specifically to reduce the vectors into our jail setting. With that, though we have restricted visits for them, we have also increased our video and telephonic visiting so that they can still keep in touch with their families. So we have a broad brush of things that we're doing across the organization, as I've already spoken to, and other hygiene things as well.
Dr. V, did you want to address this issue too of protecting people that are really working on the front lines?
Yeah, so they are a priority to protect, of course, because they're part of our healthcare workforce and part of the system that we need to keep up and running to be able to care for anyone who's ill, whether it's from coronavirus or anything else. So yes, the personal protective equipment, especially the masks, as we talked about, are in short supply, as is all the personal protective equipment. We are trying to get it out as best as we can. We have guidelines on how to stretch it as far as you safely can. There's new guidelines coming out on how to sterilize like N95 masks that I believe CDC has now posted. So we're doing everything we can to protect our first responders and our healthcare workforce.
Thank you, Dr. V. I want to remind everyone who's watching now at home, watching our Facebook Live broadcast, to go back and watch this again from the beginning later if you're just joining us. We're seeing a lot of questions come in that we've already answered. So don't be offended if we skip your question, but we're going to keep moving, and remember to re-watch it. This next question will be for Superintendent Kuykendall. So we've talked a lot about protecting ourselves and our frontline workers. This question came in from Facebook, and it refers to the breakfast and lunch program, and you mentioned one of the priorities being keeping our kids fed. So a lot of parents are concerned about the breakfast and lunch pickups and bringing their kids with them. Do you know how these programs are going to work and keep kids safe and our families protected?
Right. So they're currently in place, and they have been for a few weeks now, actually, since March 19th when the schools closed originally. The way that it works right now, it's basically a drive up and pick up. Families are picking up both breakfast and lunch at the same time for that day. And so far they seem to be working well. Our nutrition staffs have the appropriate PPE that they've requested, so we're making sure that staff is protected as well with this kind of pull-in pickup situation. And we're getting quite a few families, depending on the different areas of Stanislaus County, that are participating in these programs. And we have a commitment, I believe, from every single district that they will continue to provide meals even during the spring break. So I think that shows a lot of goodwill and planning, and obviously our schools recognize the need that our students and families have for meals.
And Superintendent Kuykendall, with the announcement of school closures through the end of the year, we're getting a lot of questions from parents that are already looking forward to the following year. This question came in from Susana Espinola Ramos, and she wants to know, how is kindergarten registration going to work?
So my answer for you specifically is reach out to your local district and ask them how they're doing that. I would imagine that instead of the typical face-to-face sit-down kindergarten registration, they're going to have to modify whatever enrollment practices that they currently have. So please, in that particular instance, just reach out to your district where your kindergartner will be enrolling and ask them how they are going to how they are going to enroll given the circumstances.
Thank you. There are more Facebook questions about what people should anticipate with end-of-year ceremonies. For example, one parent asked via social media earlier how they'll get refunds for cap and gown expenses, senior trips. How can people follow up with concerns like this?
So let me just preface it with this. This is a super bummer year to be a senior in high school or even graduating from college, because, and as a father of a senior in high school right now, I get it. You know, you were expecting that you were going to have a senior trip, potentially a prom, you're going to walk the stage for graduations, there are award ceremonies, there are all these other things that should have been happening but have now been postponed. That being said, I know that our districts are committed to honoring and recognizing their students. So there will not be a graduation ceremony in May, but I know that there will be a ceremony eventually. So first of all, I want students to understand that, and that our districts are working on what that looks like currently. As far as getting reimbursements for different things, again, that's really something where, as a parent, I would probably recommend contacting your high school where your student is enrolled and talking with those folks there about potential for reimbursement. And I wouldn't be too quick to get a reimbursement for a cap and gown. It may just be that it's not in May, it's just postponed.
Thank you very much, Superintendent. This next question is for Dr. V. We've gotten a lot of questions about this on Facebook. If you go out and nobody is around, but someone who is infected, was in the same area, around the same time, and may have coughed or sneezed, can you get infected in this way, or only if you're in the same area at the same time?
So that's a great question. We know with measles that it hangs in the air for a while, like we say an hour to two. So that would be true for measles, that you could pass through an area after someone has left and it would still be there. It may happen with this virus, but it's probably quite rare. What we've seen from this virus is it's usually you're within 3 feet, 3 to 6 feet. I mean, we like to use 6 to be further away, but it's within 3 feet to really get infected. So it would be unusual to have that happen, that you would walk through an area after someone has been there and you would become infected that way. That would be quite rare.
Thank you. As you're probably aware of, there are a lot of internet rumors and scams right now floating around. One piece of information that keeps coming up, a lot of us have seen, relates to treatment do's and don'ts. And we're hearing that it's important to avoid ibuprofen if you have COVID-19. Is that true or false?
That is unknown. There was some basically anecdotal data, so stories here and there, that maybe people who had a medication in the class of the non-steroidal anti-inflammatory drugs, they call those the NSAIDs, of which ibuprofen is one, did more poorly, but it's not been proven. So what we say is that some people are on that class of medication daily, every day, prescribed by their doctor, and they should continue it unless their doctor tells them to stop or changes the medication. If you have a fever and you have a choice between that or, say, a medication not in that class, such as Tylenol, then it might be wise to choose the Tylenol.
Dr. V, I want to stick with you for just one more moment because there's a lot of questions about this, especially as the temperatures begin to heat up. This question coming in from Facebook, will this virus go away in the summer?
That is a great question, and we don't know. It seems unlikely it will go away. What is more likely was that the spread will slow down like influenza does. We don't talk a lot about influenza in the summer, but it is still here. The spread is really small and slow. So we're hoping that with the weather warming up, the virus doesn't last as long on surfaces in warmer temperatures, and so we're hoping spread slows down, but whether it goes away or not, that will remain to be seen. I think it's unlikely that it will completely go away.
Thank you, Dr. V. So it looks like we're getting a lot of questions from Facebook for Sheriff Dirksey related to his lockdown comment. Can you please explain what you meant when you referred to the lockdown?
Yes. So we operate off of very defined terms in law enforcement as a profession. And lockdown is not something that's defined. Like I said earlier, it's something that's used in the media, but that's not the order that we are under. We are under a stay-at-home order. And so I just want people to be very clear on that lockdown has no kind of legal meaning to us. So if Dr. V issued a quarantine order, quarantine is defined, right? And with that, there come very specific expectations. And so that's why we try to use the terms that have those definitions. And stay at home now in this crisis has been defined. So we are under a stay at home order, not a lockdown order. That's just not the order that's been issued, and there is no definition to lockdown. Now, by all means, I would encourage you, if you want to lock down at home, go for it. There is nothing wrong with that whatsoever. Clearly, if you do that at your residence, you are meeting the intent of this order. Some other folks have also kind of asked about the idea of, well, it is a misdemeanor under the order that's issued. That is correct. Both our local order, it's a misdemeanor, as well as the state order. Someone can be arrested for this. But I just want to clarify, too, that the governor has very specifically said he does not want this to be a law enforcement issue. He wants this idea of social pressuring. So, and that's why I made the comments earlier, too, about like kids in the park. To me, that's the responsibility of the parents. The parents are the ones who are seeing this, hearing this. They know what's expected. So parent, take charge of your kids and don't let them get out there in big groups in the park. Get them at home.
Thank you so much for that. We're going to stay with you for a second. People are interested to know about crime trends right now, and specifically, are property crimes down because everyone is staying at home?
The answer is no. We have seen a very slight uptick in property crimes over the last week to 10 days. It's not a significant jump, it's not a major spike, so I don't want people to be concerned with that, but the answer is no. Property crimes have gone up a little bit. We've also seen an increase in domestic violence. People are at home together, not getting separation, and we see an increase, flaring of anger and so on. That's one of the reasons that this idea of getting out and doing those things that are allowed is so important. Go walk the dog, go for a run. I've had people ask, can I ride my motorcycle? Absolutely, you can do that. You can do those things on the roadway. You can go for a drive if that's what you want to do. That is, there's social distancing in there. You're, in theory, all alone on your motorcycle. So those sort of things are good, and they're good for your mental health. And that will reduce things like domestic violence or other family disturbances that are still going on. We've also seen over the last week, especially, an increase in gang activity, which we at the Sheriff's Department and across the various law enforcement agencies, we are directing resources specifically to target that.
Thank you very much, Sheriff. This next question is for the superintendent. We're getting a lot of questions right now just about early childhood education, also students with special needs. This question came in from Josephine. She wants to know, are there any potential plans for early childhood education programs like Head Start and special education programs for students who do not benefit from long-distance learning?
Okay, so early childhood education, and that includes Head Start, Migrant Head Start. It even includes some of our private preschool programs. I think there was a question on that as well. So I'm going to try to address that. So currently, what is being established is a priority in our early childhood education programs, specifically for first responders and frontline medical staff. And we're working on making sure that even though there was an initial closure specifically on Head Start programs, that we're putting those back in place, and that our priority would be for those two groups, again, first responders and frontline medical staff. As far as online learning, as it relates to our younger population, I feel like I need to remind parents that although perhaps those preschool programs aren't there for you right now, really you need to recognize that you are your child's first teacher, and that it looks like you are going to need to take that responsibility, at least temporarily, and make sure that you are regularly reading to your child, that you do things that are fun and creative, like perhaps cooking and talking about recipes and fractions and order of operations for math as you're doing that. There are a variety of things that you can do, and there's a variety of resources out there for you in the meantime. But you're absolutely correct. Distance learning is really the most beneficial when you have students of an age where they can learn independently. That's not going to work, especially for our preschool programs and perhaps even our kindergarten, first and second graders. To an extent it could, and we're exploring those different opportunities right now, but for the most part it's going to be the parents at home who are really taking that time, carving that time out, and working with their children.
Thank you, Scott. The next question will be for Dr. V, and it comes from a Facebook viewer who's asking about mental health resources and services for homeless people in need. What resources are available that you're aware of?
Well, there are quite a few resources available, and my suggestion would be to call 211 for the specific list of resources for the specific person.
Okay, here's another question for you, Dr. V, from Samantha. How accurate and up-to-date are the positive testing numbers? With the state saying testing results are 7 to 10 days behind, are our daily increases in real time, or are they also 7 to 10 days behind?
Yeah, so that's a problem with the ones that are being delayed. So we have some going through the public health lab, of which our turnaround time is only about 2 days, 1 to 2 days. So for those, we are using, prioritizing them for people who are in the hospital, our healthcare workers, because we need them not to be out of work too long, our first responders, and anyone living in a congregate living setting, because we need those answers quickly to be able to take our public health actions of mostly infection control and working to decrease spread. So we have some people that are getting quite a quicker turnaround time. For those who aren't in those groups, the turnaround time is a bit longer, and yeah, I wish that could be much faster, because that's really a problem for us. But our hospitalized, our people who are living in congregate settings such as homeless shelters or nursing homes, we are trying to get those answers back real quickly so we can take the appropriate actions.
Thank you, Dr. V. This next question is for the sheriff. We're seeing some confusion from some of our folks on Facebook about the wine industry. So this question, the beverage industry is considered an essential service, however, wine tasting rooms are not?
Yeah, so wine tasting rooms would fall under that category basically of a bar. You have too many people in there and too much opportunity for transmission. But the wine industry itself, a wine maker, is an extension of the agricultural industry. So it has an ag, obviously here in Stanislaus County, is tremendously important, is tremendously essential. We provide 25% of our nation's food, not just in Stanislaus County, but in the Central Valley, and 10% of the world's food. So even in this, people have to eat. So while some people might not think wine is important, it is part of the agricultural industry as a whole. And well, let's face it, wine sales are also up right now. So it's open, and it has an exception.
Thank you for that. We'll stick with you for a second, because there was a question that came in related to information and updated information. They're asking, is there an app or a website where people can get updated information from you?
Well, if it's specific to the Sheriff's Department, probably our #1 platform is on the Sheriff's Department Facebook page. But specific to this incident, I would tell everyone, follow this page right here, Stand Emergency on Facebook, if that's where you're at. If you're on other social media platforms, Stand Emergency is on those as well. There's the standemergency.com website if you're not into social media. And so you can follow all of it on that. And that is the simplest way. Now, a lot of stuff also references back to the state website, which is, I believe it's covid19.ca.gov. So you can always look at that one as well. Specifically, as we talk about these 16 essential services, they are drawn from the information that is on that website, and it is updated periodically as various folks reevaluate what they're determining to be essential or not essential. And quite frankly, what happens is more businesses get added to the essential list than removed from it.
Thank you, Sheriff. I think we have time for one more question as we're approaching the end of the hour. But this question is for Superintendent Kuykendall. This question comes in from Patty Robinson. She wants to know a little more about private schools. We understand that you are the superintendent of public schools, but she's wondering if private schools and public schools will be treated the same.
So I think Patty's question was specifically about preschools and the private preschools versus public preschools. And they are indeed different. They have different regulations and stipulations and requirements. There is more flexibility with private preschools, and they have been able to continue and stay open, whereas locally here our Head Start programs have closed temporarily. So there are some differences. In the meantime, though, we are coordinating with all of our early education centers and preschools out there in order to best move forward, as we know that there's going to be there's going to be a larger need for child care as we move forward with this pandemic. Again, stressing law enforcement and those frontline medical workers specifically. But just depending on which essential workers are needing to come back to work and what that looks like. So we're working with all of our partners in the early childhood education front. And it, again, just like so many other things here in Stanislaus County, people are really wanting to come together and work together to do what is right, not only for our students, but for our families.
Thank you so much. It is 6:30, so we want to thank all of our panelists tonight for being here tonight and to taking part in this really important community conversation.
We also want to thank you at home for sending in your questions. It was a really great opportunity to answer as many of your questions as we could. And if we didn't get it right tonight, we're working around the clock to answer your posts online.
For more information on the topics discussed tonight, you can visit stanemergency.com. You can also frequently check our Stan Emergency Facebook, Twitter, and Instagram feeds for updates as the situation continues to change and evolve.
So thanks again, and we'll see you next Wednesday for another Facebook Live Q&A. Stay home, stay informed, and stay healthy, everyone. Good night.